As I told you, that still on ECG, but before we do anything else, we have to first understand the physiology, the cardiac physiology. We have to understand, that is only electrophysiology, the conduction system. Because from there, we record ECG. ECG is just a recording of the cardiac electroactivity. You record the cardiac electroactivity. So meaning before we generate the impulse, the cardiac impulse, there must be some anatomical features of the heart that is responsible for that. So we have to understand that. The next things in ECG, the next topics, you must have understood this one. So that's why we have to do this one first. That is electrophysiology and then conduction system. So the heart is capable of generating impulse like any other muscle. It has a muscle, that's myocardium. We know that one. It has a myocardium, no? So this is a myocardium. This is a myocardium of the heart. And if we name, this is left ventricle, right ventricle, and then this is the apex, and then this is septum, interventricular. That is interventricular septum. Then from here, if you want, you draw the artery. Draw the atria. This is the mitral valve, and then this is tricuspid valve. This is left atrium, and then this is right atrium, right? Like that. So the conduction system is within these structures. The conduction system we have in this feature, in this flow, we have the SA node, we have from SA node we go to AV node, from the AV node we go to bundle of His, we go to bundle branches, that is left and right. And then we go to Purkinje fibers. That is the flow. So location, since this node is the highest, it is going to be located somewhere here. If we can put, this is the SA node. Now from SA node, AV node is going to be somewhere here. AV node. And then from AV node, we are going to go down bundle of his. And from bundle of his, we are going to take bundle branches. Bundle of his, then left bundle branch, right bundle branch. So also here we have, and then here we have some impulses conducted. So this is the normal flow. You understood? This is left bundle branch, this is right bundle branch, and then this is bundle of his. These are Purkinje fibers, and then this is AV node, and then this is SA node. And then these are internodal fibers. Yeah. So that is the conduction system. It is crowded, but it's clear. So again, in the normal heart, the SA node, this one, will act as the pacemaker. What is a pacemaker? A pacemaker is any tissue that can generate impulses that run, that determine the heart rate. If the SA node is generating impulses at a rate of 72 times per minute, then the heart rate is going to be, the heart will also contract 72 times in a minute, and it will be the work rate, the depolarization rate of SA node. So SA node is the pacemaker, meaning it can generate impulses very fast than other tissues in the conduction system. Which other tissues? Another one is AV node, and then bundle branches or myocardial fibers like these Purkinje fibers, they can generate. So this SA node can generate impulses from between 60 beats to 100 beats times, or beats per minute. And that is what we said, the normal heart rate. In a normal heart, the SA node is the pacemaker, and it can pace the heart at rates between 60 and 100. That's what we say, the normal heart rate. So the next one, because it can fail, this is like a mechanical system, and it can fail. So if it fails, the next one is going to be the AV node. The AV node can also pace the heart, act as a pacemaker, secondary pacemaker, and it can pace at rates 40 to 60 beats per minute, theoretically. So if this one fails, then this one will take over the pacing, and it will pace at this time. So if SA node is pacing, we have normal heart rate. If AV node paces, we shall be in bradycardia. Bradycardia will be there if AV node is pacing. Now, if these ones are pacing, Purkinje fibers, if we can see, or myocardium anywhere, if they are pacing, they can only generate impulses from 20 to 40 beats per minute. So this one will be bradycardia, but a severe one. So from top to bottom, the pacing rate, the depolarization rate decreases, keeps on decreasing. So this is a special tissue that is there to pace the heart. So in all hearts, in all normal hearts, normally working hearts, the impulses come from SA node, and then they go down from SA node through the internodal fibers to AV node, from the AV node through the band of His, from the band of His now it goes to right ventricle, and then to left ventricle through the bundle branches, right bundle branch and then left bundle branch. Simple like that. That is a normal conduction system. SA node, internodal fibers, AV node, bundle of His, right bundle branch and left bundle branch at the same time. So if we talk of these terms, depolarization, and then contraction, these two terms, they are different. Now, if an impulse is generated and it, like from SA node, is generated, if it moves out, whatever the tissue, it depolarizes. The SA node first depolarizes, and then the impulse travel. This is like electricity traveling in wires. It generates impulse travel to the left atrium through the Bachmann's bundle, and then to right atrium. And first to the atria, impulse has to move. When the atria impulse reach there, then the atria are depolarized. And then when after depolarization, they contract. Contraction occurs after depolarization. So when the impulses move to the atria, both of them at the same time, the atria depolarize. When they depolarize, they contract. So when the impulse passes through the atria, they enter the AV node. AV node also depolarizes, and it allows impulses to pass through. When impulse pass through the SA node, the AV node, they enter the bundle branch, bundle of His. It keeps on depolarizing very fast, and then when it reaches, until when it depolarizes, the entire myocardium of the ventricles. This is the myocardium. This myocardium already showed. It depolarized the myocardium. So if myocardium is polarized, then contraction of the ventricle is going to occur. So from whatever I've said, the ventricles, the atria contract before the ventricles because the impulse reaches the atria first and then the ventricles second. the atria, the impulse reach the atria first, generated in the atria contract first, and then next the impulse move through the AV node and then to the ventricles, and then the ventricles contract next. This is fast movement. The impulse moves so fast that there's no time. Everything happens within less than a second, in microseconds. That's what we are talking about. So if we are recording the ECG, we are recording the waves of depolarization and repolarization. After depolarization, there must be repolarization. So with ECG, we are capturing all those things. We are capturing depolarization and then repolarization. Depolarization first, and then we go to repolarization. We go to repolarization. So with the ECG, we are recording the cardiac electroactivity in terms of depolarization and the repolarization. We have said the impulses from SA node, it spreads through the atria, so the atria get depolarized. It moves through the AV node next, and then it reaches the ventricles. Ventricles get depolarized. So when the atria is depolarized, they have to repolarize. AV node depolarizes and repolarizes. SA node also depolarizes and repolarizes. Ventricles depolarize and repolarize. So now we are going to see on the ECG which wave represents which one. This is the ECG. P, Q, R, S, T. This is a normal ECG we can see. So on the ECG, which wave represents which? We have said impulses generated from SA node spread through the atria first. The atria depolarize. So if atria depolarize first, then P wave, this is P, is going to be for atrial depolarization. And then from atria, the impulse move through the AV node. AV node has to depolarize and repolarize also. But AV node is very small. Even SA node is very small. These two, AV node and SA node, they are very small, that their depolarizations are not captured on the surface ECG. This is surface ECG that we put on the skin. So their depolarizations and repolarizations are not captured because they are small. Whatever the voltage they are producing is very small. The ECG machine does not record that. The atrias are big, they produce enough voltage, the ECG machine can capture that one as P. So this is depolarization. Depolarization is always positive, and repolarization, we'll first leave that. We don't mix. So if SA node depolarization is somewhere here, and then the impulses take some time to reach atria, and then atria depolarize from here, and then impulse takes some time to depolarize the AV node. So this segment from here to here, is called the PR segment, and it signifies impulse conduction through AV node. Samje PR segment from here, end of P to start of Q wave. It shows impulse conduction through the AV node, but we are not recording anything, it's a flat line. Now from there, when impulses move out of AV node, they are going to move so fast to go to the ventricle. So the QRS, this is Q, S, and then this is R. The Q, R, S, it is for ventricular depolarization. As I say, this is QRS, represents ventricular depolarization. That is both ventricle at the same time. Even here P is both atria at the same time. And this is the normal P. It has to be positive, I told you. Positive in all leads except AVR. QRS complex. Q can be there or may not be there. S may be there or may not be there. R may be there or may not be there. The most important thing is naming. The first negative wave after P is Q. The next positive wave after Q is R. And then the next negative wave after R is S. So, next, after ventricular depolarization, there come a point called J point. That is end. And now there is this segment here. This segment called ST segment. What does it indicate? It indicates ventricles at full depolarization. Just waiting to repolarize. Ventricles at full depolarization, just waiting to repolarize. That segment is represented as ST segment. So ST, end of S, and then beginning of T. Now there comes this T wave. Representing ventricular repolarization. Yes, that is the full interpretation of our ECG as this is how we can connect the ECG to cardiac electroactivity. So we are seeing on ECG, we are seeing atrial depolarization, ventricular depolarization, and ventricular repolarization. Those are the three things we are seeing on the ECG. Impulse propagation through the AV node, no wave is there because it is very small tissue. At full ventricular depolarization, sometime is there when they are just waiting to repolarize and represented as ST segment. P or atrial repolarization is not seen because it happens within the QRS complex. We cannot see it. So that is it. That's all we can say from here, that this PR here, ST segment or PR segment, it has value, the normal value, and it has a normal value, and it can be from 80 to 120 milliseconds. That is its interval, its time. It is very important because with the prolonged PR or with AV blocks, with heart blocks, it is going to be affected. Yes, not that one, it will be affected. So this is the normal value. You count calculate the time, PR segment time. If it's prolonged, probably PR interval is prolonged. Thank you.